All right, good afternoon, everyone. My name's Aaron No. I'm here to talk about triage this afternoon with you. Now, triage is a unique concept. It's a concept that we sort of put into play when we have a lot more patients than we can handle normally through our routine emergency services. So, sort of what I can think of is a couple different scenarios when it comes to decon. Is when we have maybe one or two patients coming in to the emergency department and we have to decon them before they come in for care. That's a pretty routine process for us. We can go ahead and set up our decon station, provide a high level of care both before their decon, during the decon, and after the decon process. But what happens if we had a busload of patients show up to our emergency department here and we needed to decon them and provide care for them, as well as try to decon all of them before they came in? So how would we go about taking care of 25 or 30 patients that needed to be deconned? Triage is a French word to sort, and we're going to use a special mnemonic here. It's RPM for respirations, perfusion, and mental status. Those are the three important criteria that we're going to utilize to screen our patients or to sort them out into different categories or different levels of acuity, so we know who needs to receive the care first. So if we have a busload of patients show up and they're now unloading off of the bus there into the parking lot area, we have our decon station set up. The first thing that we can do is, obviously, if we're in the hot zone and they're contaminated, what do we need to have on first before we can even start to assess them? We need to have our PPE that's appropriate for that level of decon that we're performing. So we need to make sure that we have a nice perimeter set up, that we're controlling the scene, and then also that we have enough personnel to manage that, and we have a good decon set up. The first thing we do, if we have a busload of people coming off the bus here, is to do our voice triage. So whoever is in charge of the triage area, we need to actually ask everyone that can basically get up and move over to an area, so we can designate, maybe this is our hot zone area, our intake area. So we can welcome the people off the bus and say, okay, if you can walk over here, I need you to come over here and sit down on these chairs we have set up for you. If they're able to get up and walk, we know that they're actually green already. So some of our other patients that might need to be triaged would be those that either can't walk off that bus, or maybe that they're being brought in by ambulance and they're being wheeled out on a gurney and we have to evaluate them. So if this patient came off of a gurney or came off of an ambulance and wasn't able to walk by themselves, that we already know that they're not in the green category, then we can go ahead and use our RPM to test whether they fail any of those things and categorize as a red or immediate patient. And if not, then we can go ahead and categorize them as a yellow or delayed patient. There's one other category that we're going to have with our decon patients, potentially, and that's our deceased patients. So if we don't detect any respiratory effort, if they're not breathing, there's no chest rise, we'll take one opportunity to go ahead and open their airway using a head tilt chin lift. We'll check for respirations, and if they're still not breathing, then they're deceased, and we move on to the next patient. As we go through, though, we're going to do a quick medical triage to see who probably needs the care most urgently in terms of the medical care. When it comes to mass casualty incidents and contaminated patients, it gets very challenging. We don't have clear guidelines on how much advanced life support we are going to be able to provide, because pretty much any medical equipment that we use in the contaminated zone or in the hot zone will then need to be switched out or decontaminated as we process that patient in through the decon station. Something else to consider is the agent that you're dealing with. Is this something that's really potent? Is it something that could disable somebody very quickly or injure somebody if they get exposed to it, or is this a low-level contaminant? That will also determine how much care we can provide in the pre-decon setting or in the hot zone. So going back to our three criteria, this is a criteria that's established by the START triage guidelines. So RPM stands for respirations, perfusion, and mental status. And the first thing I can do is, if I have a team of a couple people, we can work together, we can kind of split up. I'm just going to walk up to the closest person next to me, and we want to triage everyone there and tag everyone with a medical acuity so we can know exactly where everyone is at. So the first thing I'm going to do is, when I walk up to my patient, I can go ahead and start having a conversation with them. Sir, how are you doing today? But I'm also looking at his breathing rate. Okay, I'm looking for chest rise, and I'm looking for either those respirations to be very fast or normal. The threshold for or cutoff for very fast is if it's going to be over 30 breaths per minute. So that's somebody who is obviously in respiratory distress. They're breathing very quickly. They may not be able to carry on a conversation with you because they can't catch their breath. And if I notice that this gentleman here is breathing fast, I'm going to go ahead and just red tag him right there. I don't need to evaluate anything else because you only need to fail one of the 3 criteria of respirations, perfusion, or mental status, and you get red tagged. So let's say he is actually breathing at a normal pace, somewhere maybe 16, 18, 20 times a minute. He can have a conversation with us. Our next step would be what? Respirations, and we go to perfusion. There's actually 2 ways we can check perfusion. I can simply check for a radial pulse, okay? But sometimes that's hard to do if we're really excited, our own pulse is really going, maybe it's just hard to find on that patient. Another easy option is to go ahead and check for what we call capillary refill. That means just to squeeze down on their nail beds, on their nails, and let go, and watch for the color to return. So what we're doing is we're compressing the capillaries in their fingers, and when we let go, we've pushed all the blood out initially. Now when we let go, how long it takes for the fingers to refill and the color to return tells us a little bit about their circulatory status. So if their capillary refill is slow, say over 2 seconds, then I'm concerned that his circulatory volume or his heart and his heart rate or just his ability to pump blood throughout his body is compromised. But if it's under 2 seconds, then I know he's probably okay and he actually passes that. Now, what do you do with somebody who's got nail polish on? Does that work? No, that's not going to work on fingers with like a lot of nail polish. You can flip their hand over. You can do it on the palm of the hand as well. So you'll look for the color to return to normal on their palm. So there's a couple places you can do that. Things that might affect this though, if it's really cold outside, let's say it's wintertime and it's 40 degrees outside and their hands are cold, they're going to have already shunted their blood. They're not going to be having as much perfusion in their hands and their distal functions, so their extremities. So when we do that, we may notice slow capillary refill, but they actually have normal perfusion, all right, or blood flow. All right, so if they've passed those 2 tests, the last test that we're going to check is mental status. And what we can do to check that is just to ask them a very simple question. So I can ask this if I maybe in talking with him, or just because I know he came in, I know that his name's John. It's like, John, can you squeeze my hands? Okay, so I can check for actually 2 things here. I'm checking to see if he can actually hear me as well as move his fingers and follow those commands. If somebody can do that, then their mental status is considered okay. All right? Let's say though he's got some injuries maybe to his arms or his upper extremities, and I'm concerned that he's not going to be able to actually squeeze my hands due to his medical condition. What I can do is I can actually say, can you go ahead and blink your eyes 3 times? So there's a couple of different things we can do depending on the sites of their injuries. If he's passed those things, then those 3 criteria, respirations, perfusion, and mental status, then I know that he's not a red category. What about situations where you have somebody, maybe there's CPR in progress? How do we treat that in a mass casualty environment? Likely we're going to have to tag them as black. It depends on our resources. If you have enough people that you could do CPR, we are at the hospital. But at the same time, if you have 2 people doing CPR that are all completely suited up for decon, what does that do? It means you can't process all of those other people that need to be deconned and moved in. Many of those people may be red tagged or immediate tagged, which means that those are individuals who might die in the next 20 minutes, 30 minutes, or the next hour if they don't get immediate care. So by taking 2 of our decon responders out of the scene to dedicate to providing, say, CPR or a really intensive care to 1 person, can mean that a lot of other people's lives are put in jeopardy. So typically, if we have a patient that's requiring CPR in a mass casualty incident, and we're in the hot zone or in the dirty zone for decon, we've got to go ahead and black tag those and focus on the patients that actually do have a chance of being salvaged and saved.
Hi, are you guys coming from the hazmat event?
Yes, I brought 6 patients with me and more on the way. I think I got something on me when I was putting them in the truck.
All right, you can just go ahead and reverse and pull the truck up that way.
Control 22, I got 7 patients coming in for decontamination.
If you can walk, come to us.
Decon team lead to hazmat branch director, come in please, over. Go for hazmat branch director. Hazmat branch director, we have taken into the decon treatment area 7 patients with varying acuities. We have 3 green, 1 yellow, 2 red, and 1 black. Over.